Essential English Phrases for Nurses. Hello and welcome to ASM Learning. Today I'm excited to share with you some essential English phrases and communication tips designed specifically for healthcare professionals. Whether you're a nurse, a hospital administrator, or part of the support staff, effective communication is absolutely critical in a hospital setting. It not only helps in providing the best patient care, but also ensures smooth operations behind the scenes. In this video, we're going to cover real-life scenarios you encounter every day, from greeting patients, explaining a procedure, to handling phone calls, and managing patient records. My goal is to equip you with practical language tools that will boost your confidence and help you excel in your role. I understand that working in a hospital can be challenging, especially when English isn't your first language. That's why these phrases are tailored to help you communicate clearly and professionally under pressure. So, whether you're new to the field or looking to refine your language skills, this video is for you. Stick around, take some notes, and get ready to transform your everyday conversations at work. If you find this helpful, please like, subscribe, and hit the bell icon to stay updated with more workplace English lessons. Let's get started. Essential English Phrases for Nurses. As a nurse, your role requires clear and professional communication with patients, doctors, and colleagues. In this section, we'll go through essential phrases that will help you in different hospital situations, whether you're greeting a patient, explaining a procedure, or giving instructions.
Unit 1. Greeting and comforting patients. Good morning. My name is Susan, and I'll be your nurse today. How are you feeling today? Are you in any pain? I'm here to take care of you. Let me know if you need anything. Practice tip. Please repeat the following phrases. Unit 2. Taking vital signs and asking about symptoms. I'm going to check your blood pressure now. Can you roll up your sleeve, please? Your blood pressure is normal. Let me take your temperature. Please keep this under your tongue. Do you feel dizzy or lightheaded? Interactive tip. How would you explain taking vitals in your own words? Practice tip. Please repeat the following phrases. Unit 3. Explaining procedures and giving instructions. I'm going to give you an injection. It might hurt a little. Please hold still and take a deep breath. It's done. You did great. This medicine might make you feel sleepy or drowsy. You may feel a little discomfort. Let me know if you have any pain. Your comment. What's a common phrase you use when explaining procedures to a patient? Please write in the comment section of the YouTube. I will review and reply. Practice tip. Please repeat the following phrases. Unit 4. Giving medication instructions. You need to take this medicine twice a day. Take 1 tablet after meals. This should be taken with water. Please don't skip any doses. If you feel any side effects, let us know immediately. Practice tip. Please repeat the following phrases. Unit 5. Responding to patient requests. Of course. Let me get that for you. I'll be right back with your water. Let me help you sit up. I'll inform the doctor about your request. Interactive tip. Type one polite way to respond to a patient's request in the comments section of the YouTube. Practice tip. Please repeat the following phrases. Unit 6. Communicating with doctors and colleagues. Doctor, the patient in room 205 is complaining of chest pain. Her blood pressure is 140/90. She has a fever of 38.5 degrees Celsius. She says she feels weak and nauseous. Practice tip. Write a short nurse-doctor conversation in the comments section of the YouTube. Please repeat the following phrases. Conclusion. Clear communication is key to providing excellent patient care. Practice these phrases daily, and you'll feel more confident at work. If you found this helpful, like this video and subscribe for more workplace English tips. See you in the next lesson. Thank you for watching.